good. Okay, Dom, how are you? Good to see you. Alright, so you want to give me a bit of a wave if you're good on sound? You one up there. Cool. Couple more to go. Alright, you want a bit of sound? Mark Bailey, Minister for Transport, Main Roads. You want a little bit closer. All good? Yeah, terrific. Okay, so good news for Queensland is 0 new cases overnight. We have 12 active cases in the state at the moment, and I wanted to say a big congratulations to our high schools who have been helping with the vaccination tasks. We've done more than 1,500 vaccinations at high schools in the last couple of days, more than 1,000 vaccinations at the Surf Lifesaving Club. So people down there on the beach doing a great job helping get vaccinated. We've seen more than 300 at theme parks as well. We're up to 77.3% people with their first dose, and we're now also at 63.5% people with their double dose. So look, this isn't just a race now, it's a sprint. We need people to get vaccinated, and we need that to happen ASAP because you need to be vaccinated and protected for when the borders open, and there is no issue with supply. There is ample ways of getting vaccinated, and particularly for regional Queenslanders. You know, if you want to avoid a regional lockdown in future, then get vaccinated right now. It takes 5 weeks to get full protection if you get vaccinated today, 3 weeks until your second jab, and then 2 weeks before you get fully protected. We want every single Queenslander to be fully protected as early as possible, and that's what we need to do. So the task is there for people. If you've been putting it off, you've been not getting around to it, this is the time to do it. And if you know friends and family and workmates that you love who haven't been getting it done, this is the time to have the conversation, because the earlier we all get vaccinated, the earlier all the benefits of coming out of the pandemic are there for everybody in our community. So it's a real pleasure to stand up today with the Deputy Chief Health Officer. Of course, the last message today from Dr. Young on her last official day as the Chief Health Officer is get vaccinated, and I support her 100%, and we want to see Queenslanders protected. I've got Lynn McKinlay here, Deputy Chief Health Officer, who's got a few words to say. Thanks, Lynn.
Thank you. And look, I haven't obviously got a lot more to say. It's great news again that we've had no cases in Queensland. I would continue to encourage people to go out and get vaccinated. I think it's really important to understand that vaccination will protect yourselves. It'll also protect other people, and it'll protect other people not just from COVID, but it'll also protect people who need to come to hospital for other care. So if we keep our hospitals available so that people who need care for any reason can come and get care. The other thing is, I'd just like to mention I'm a paediatrician by background, and I think it's really important that what I could say is that it's really important for families that you get vaccinated so that you can actually look after yourselves and prevent infection for the vulnerable members of our community, and be there to be able to look after your children once the virus does start to come across our borders. So I'm happy to take some questions later if there's any. Thank you.
We'll just deal with health first. So any questions on health?
I just wanted to ask you on that. We've heard from the Premier even tweeting today that today is your very last chance to get vaccinated.
Sorry, that last bit, Shannon?
You're saying it's 5 weeks, or 6 weeks to get fully vaccinated?
Look, it's 5 weeks to get full protection from when you get the first jab, second jab, and then it's 2 weeks after the second jab that your whole system absorbs every bit of the protection. So it's not just a race now, it's a sprint. There's lots of opportunities to get vaccinated. Now is the time for every single person who's been not getting around to it or whatever. This is the time.
So is today your last chance?
Would you like me to?
Well, of course, people can get vaccinated. It's a sprint. People need to do it today, tomorrow, as soon as they possibly can. ASAP. Linda, do you want to say a few words there?
Oh, thank you. Thanks, Minister. That might be because some people now are able to access the Moderna vaccine as well as the Pfizer vaccine. They're the two main vaccines available. So Moderna is available in over 600 pharmacies across Queensland, and Pfizer is available at pharmacies and at some GPs and in our Queensland Health vaccination clinics. The Moderna one is a slightly different schedule, so that's 4 weeks between the doses plus 2 weeks. So even after, this idea about this being the last chance, we want people to still keep coming forward you haven't missed your opportunity. We want everybody to keep coming forward, even if it's after today.
Are you worried that some people just won't come forward though anymore, because all the messaging's been, this is your last day, that's it, if you're not done by that, well, you're stuffed, and now will people still come forward after this?
Yeah, let me say again, I think we're still going to have vaccine clinics will be available. They will be going on into the new year. So if you haven't come up for your vaccine, please do so now or next week or whenever you feel ready to do it. I know some people will still have questions. The best person to answer your questions is probably your GP, your local pharmacist or the nurse at your local hospital. They're all able to answer your questions and hopefully be able to reassure you to the extent you need.
That 77.3% first dose rate, surely that's not good enough and it puts us in a good position for when we do reopen?
I'm not sure I
That
understand the question.
77.3%, is that where we need to be? Would you like to see that higher? That's surely not good enough in terms of, what we've been told about it takes 5-6 weeks
Yeah.
before to reopen.
So if we're already at 77%, we know that at 3 weeks' time we'll be at least 77% double dosed. When you look at that roadmap and that reuniting families, you'll see that what we're really trying to get to is 80% by December and then 90% as soon as we can. So I'm absolutely with you. We want to get everybody vaccinated, as many as we can.
In terms of when, the borders do open and COVID comes into the community, what will happen with schools and workplaces? Will they close down?
So once we do get spread of the virus in the community, there may still need to be some localised lockdowns. Now, the higher vaccination rates, the lower the risk of that. So that's why we're really pushing for people to continue to get vaccinated. But what we're hoping for is that those public health and social measures can be much more localised rather than widespread, which is what we've had to do in the past.
So do you envisage then schools having to close down if there is, say, a student who gets sick or a teacher?
I think it's hard to judge in each individual outbreak what will happen. We'll have to judge each one on its own merits. Our public health units work very hard whenever there's an outbreak to make the best decisions to keep people safe while, limiting the impact on the community.
I noticed the messaging from both of you is this is not your last chance today. That's very different to the Premier. Do you think that's the wrong position to take?
I think what the Premier is trying to do is to create that sense of urgency. I mean, I'm not trying to speak for her, but there is a sense of urgency to have everybody vaccinated before the borders open. What I'm trying to say is if you haven't been vaccinated, please do continue to go and speak with your general practitioner, your pharmacist or your nurse and get the encouragement you need, the confidence you need to go and do it because it's so important.
Is it a concern that we won't reach 80% by December 17 and the borders will open if COVID inevitably comes into Queensland?
I think we're confident that we'll reach 80% by that time.
It's the Chief Health Officer's last day today. Did you put your hand up for the job or would you consider the job?
I didn't put my hand up for the job, no, and I'm confident that Dr. Aitken, is going to be doing the job temporarily, is going to be a wonderful person to do the job. He's got a lot of experience and I'm really confident in his ability until they select a new Chief Health Officer.
Can you see why people are a bit maybe worried or concerned? We've had Dr. Young for so many years and she's been such a familiar face, and now we don't really know who's going to be the next Chief Health Officer or what would be the most crucial time.
Everybody is obviously going to miss Dr. Young. I'm sure that all of the journalists will miss her as well. She's been an incredible leader and provided such incredible safety to Queensland during the time she's been Chief Health Officer. We have got a large team behind Dr. Young, and that includes Dr. Aitken, who's taking it on, and he's been very involved in this since the beginning. So we've got a great team and we'll continue to work really hard to keep Queenslanders safe.
Just finally, if you are wanting to get vaccinated by December 17, some clinics open till late tonight, so still going to get vaccinated after 6 o'clock?
There are lots of clinics open today. I haven't got the details of the opening hours in my head, I'm afraid, but we have got many of the pop-up clinics available today at a number of schools, surf lifesaving clubs, the theme parks again, as we did over the weekend, as well as the other mass vaccination clinics. I think some of those mass vaccination clinics have got later hours, but I'd encourage all your listeners and viewers to go and have a look at our website.
In terms of the border, I know some states from tomorrow open up their borders both domestically and internationally. I guess what's your word or advice to Queenslanders who I guess are a bit frustrated with that?
Do you want to answer that one?
Yeah, no, I'm happy to take that one. Look, this pandemic has been an incredibly difficult experience for everybody over the last 2 years. This is a responsible and measured plan in terms of reopening to come out of the pandemic based on the health advice. So what we want to see is people get vaccinated as fast as possible. If people get vaccinated quicker than we expect, then we're in a much stronger position to re-look at things. Yeah, look, I certainly encourage all Queenslanders to make sure they keep checking in every single time. We still need that contact tracing capability, and we are going to have COVID get to Queensland. People got to understand, whether you're in regional Queensland or Brisbane or Gold Coast, COVID is coming. You will be exposed to COVID. So that's why you've got to get vaccinated, but we've also got to keep our capability of tracing when there's outbreaks so that we can inform the public and so that we can respond to that and protect Queenslanders. Sorry, you'll have to speak up a bit with the traffic behind me. Oh, look, that'd be a matter for Queensland Health, but I'm sure there is a thorough process. As Lynn said just before, we have an incredibly strong team that have worked with Dr. Young from day one. So I'm very confident that we will have a very formidable Chief Health Officer to replace Dr. Young. Their team will keep working as they've done for the last 2 years to protect Queenslanders, and I thank them, for an incredible amount of work they've done to do so. They've been very, very effective.
Do you think got vaccinated by now, they're not really trying to get vaccinated, are they? What else can the government do to encourage them to get vaccinated?
Oh, well, I don't accept the basis of your question there, John Paul. There's a lot of people out there who aren't necessarily so plugged into day-to-day current affairs who have been thinking about it. Maybe they'll get to it, but this is the time for them to switch on and get the jab done. So look, we've got to stay positive and proactive. What we've seen in other states is much higher levels of vaccination where there's been big outbreaks, where people understood the threat because it's been right on their doorstep. Queensland's been in a better, stronger position overall, but now is the time, particularly in regional Queensland. I say to regional Queenslanders, COVID is coming. Are you prepared? Because when you get exposed to COVID, we want you to have the vaccination fully in your system so that you're in a very strong position, and everyone in your community as well.
Do you think that's the only real initiative to make people get vaccinated though? I mean, you put pop-up clinics at Bunnings now, at theme parks. I mean, where else do you put them? You put them in high schools. You only got 337 people at a theme park over 2 days. How much easier can you make it? And what do you think it'll literally be an outbreak that'll actually make people finally get vaccinated?
Well, I think what we've seen is the numbers of people getting the jab have been increasing considerably over the last month. And the Premier, the Chief Health Officer have been very clear. Get vaccinated right now has been the message. There's been a sense of urgency about it. We've seen Queenslanders respond. But we need that last 20% or so of Queenslanders to get it done right now. They're the people who don't watch current affairs, don't watch live press conferences, maybe watch other things. They're the kind of people we've all got to have our conversations with. I know I'm in that situation. I have relatives who I'm still talking to about getting the jab, and they're getting there, which is really good to see. We've all got to be a community about this and take people with us, and that means getting to those people who don't ordinarily hear the sort of messaging that people who are interested in current affairs and politics get every day. Sure.
Do you think international travel could, roll out in Queensland before we hit 90%?
That's a decision that's going to be made with a lot of input from health and from a whole lot of decisions about what's happening across Australia as well. A lot of those decisions are being made looking at the data and looking at the modelling. So I can't really predict or make a comment on that otherwise, sorry.
I was going to say, because Queensland is one of the only states and territories with that 90% threshold, so, could it be earlier?
I can't really comment on that, sorry. I think we'll have to wait and see what the modelling shows.
Just finally, from your perspective, what more initiative you can put out there to get people vaccinated? I mean, told them today's D-Day, you put it everywhere. Why do you think people can't get it?
I guess if we knew that, then we'd be in a different position. What I would say is we've got people still getting vaccinated, and I know that you said 300 people. That sounds like a small number, but actually those are 300 people who might not have got vaccinated otherwise, and so those 300 people count for a lot. I think over the last, like yesterday, in total across those pop-up clinics, we had something like 3,000 people got vaccinated. And those 3,000 people, that could be something like, let me just check my figures so I don't get this wrong, 15 lives saved. If those people all got into trouble with COVID, 15 of those people might have died. That would save 100 emergency department presentations. As I said before, if you're going to go to an emergency department with your heart attack or your sick child, that's 100 less people with COVID in the emergency department. So those 3,000 mean a lot. Of course we'd like there to be more.
Good. Thanks, Lee. Fantastic. All right, so we might do the road safety part of it, if that's okay. Here with Deputy Commissioner Steve Donnelly. Thanks for joining us, Steve, and Steve will say a few words in a moment. Look, what we're seeing here on our roads has still been a bad year in terms of lives lost. We saw our lowest ever year in 2019, and we saw a big uptick in the number of fatalities last year, which is something that needs to be addressed, and this year is also up again on that. So what we're seeing is too many Queenslanders doing dangerous things behind the wheel and paying the ultimate price. Two of those incredibly dangerous things are being distracted by your mobile phone. And the research is really clear. You know, if you're driving distracted with your mobile phone, it's like having 0.07 to 0.1 blood alcohol in your system driving drunk. You're not ready for what's going to happen in front of you, and you know these are fatalities that are happening in Queensland. It still amazes me the number of people who don't wear a seatbelt in this day and age. That's your last line of defence. When something goes wrong, the seatbelt will often save your life. So tomorrow we see these high-tech cameras. They're world-leading high-tech cameras that see into from above your driving capsule, and they will tell if you are driving distracted or if you've got a seatbelt not on, or both. And there are heavy fines, $1,033 if you're caught driving distracted, more than $400 without a seatbelt, virtually $1,500 if you're doing both. So these cameras will be anywhere, anytime, right across the state, just like random breath testing. Queenslanders have fair warning. We've had 3 months of putting them in, sending warning letters. Regrettably, more than 20,000 Queenslanders have been getting warning letters about them doing the wrong thing. From tomorrow, there's absolutely no mercy. We will be fining you, we will be catching you. So if you're one of these people that drives distracted, put it away, otherwise you will be caught because these cameras will be everywhere and they will move regularly. What we're doing is we're moving them regularly into places where we've got high crash rates, where there's greater danger, and they will be moving regularly. People will be very surprised to be caught on roads that they never thought they would get caught on. So enough is enough. Drive safely. If you drive safely, you won't get fined at all. This is driving distracted is the drink driving of this era, and it has to stop. And we are totally unapologetic about getting tough on it. And these high-tech cameras are world-leading. We are the first jurisdiction in the world to switch them on in terms of the seatbelt capability. And sadly, in regional and rural Queensland, we're seeing still a lot of people not wearing seatbelts, and that's got to stop. Steve.
Yeah. Thanks, Minister. First, I'd say the Queensland Police Service strongly supports the introduction of the cameras. The trial has shown that the technology has significant potential to improve safety for all of us on our roads by targeting those two behaviours the Minister spoke about. So that's people engaging in the practice of using their mobile phone instead of focusing on the driving task. And the second is people who don't seem to comprehend the significant forces involved in a crash and choose not to wear their seatbelt and not be properly restrained in the motor vehicle and prevent that trauma to themselves in the event of a collision. So the police officers will still be out targeting these two offences through mobile patrols and other operations, but the deployment of the cameras in both urban and rural locations and operating 24/7 will detect these offences and ensure that there's a consequence for that behaviour for people who engage in it. And those two behaviours are something that we can all choose not to engage in. Thanks, Minister.
Thanks, Steve. Cheers. Any questions?
So in terms of the trial that went for 3 months, you said there was roughly 20,000.
20,000, yeah.
How many of those were independent, and how many people did it a second time?
Oh, look, I'd have to come back to you on that data, but what we saw is 18,000 people driving distracted and nearly 3,000 people driving without seatbelt. So these numbers are incredibly concerning. We know that a proportion of these people are going to be in crashes and they're not going to be ready for it, and it's going to have very tragic and sometimes life-changing outcomes for people that survive the crash but might have permanent injuries.
And when you set out to do this trial, you obviously recognised that there was an issue with people using their phones and not wearing their seatbelts. Did the results still shock you?
Yeah, look, the numbers are still incredibly shocking. After 10 years of discussion education, everyone agrees it's a bad thing. There's still too many people who are addicted to their phone and doing the wrong thing. So enough is enough. From tomorrow you will get caught. 100% certain. If you drive distracted and don't have a seatbelt on regularly after today, you will get caught. No doubt about it. It's going to be painful on the wallet. It's going to be painful on the demerit points, but you deserve it because you're not just endangering yourself, you're endangering other people, and that's just not on.
These fines are more than double that of other fines for mobile phone use in Australia. Is this just a revenue grand scheme?
Look, certainly not. This is simply a case of people driving dangerously, and education has helped for some people. For other people, clearly they need something that's going to really motivate them, and that is, a hefty fine. And look, everyone's seen it. Everyone's seen that person weaving ahead of you, nearly sideswiping somebody because they're not looking at the road, they're looking at their phone. We've all seen the people, staying stationary on a green light at the traffic lights. We've seen it. Everyone's seen it. Enough is enough. You're either driving or you're using your phone. You're not doing both at the same time. Separate them and everyone's safer. Enough is enough.
And what about the locations of the cameras?
Well, we are not telling people where these cameras are because you can be caught anywhere. These aren't just going to be on a motorway. These are going to be on often quite local roads where there's been issues around safety. So what I say to people is, just like random breath testing, you can get caught anywhere, anytime. Exactly the same with mobile phone distraction and seatbelt cameras. They are here, they're being switched on, and they're right across Queensland.
And in terms of the demerit points, if you get caught twice, it's double demerit, which means with the 4 points on your phone, you could lose your licence.
Yeah. So look, if you get caught twice within a 12-month period, it will be double demerit points and double the fine. So if you get caught, lose 4 demerit points for distraction, you'll get 8 demerit points the second time and lose your licence. So, is really answering that call or making that call worth losing your licence and maybe your job? It really isn't. So this is a time. Sort it out. We've given you fair warning. Now we want people to actually do what they're supposed to do.
Minister, do you mind if I ask a few other questions?
Sure.
Okay.
Hmm.
You're standing up today.
Yeah. We're all done on driving, I think.
It's
So.
been 1 year since the election. What would you say has been the government's timeline?
Well, I think that the handling of the pandemic by the Premier, the Deputy Premier and the Health Minister has certainly been a highlight of the last 12 months. We've kept Queenslanders safe. That's been our objective. It still is our objective as much as ever. But I think when you look at what's happened around the world, the tragedies that happen around the world, Queensland is really quite different to date. We want to keep it that way. But certainly that's been something we promised to do, and we've certainly done. Oh, look, I'll leave that for others to judge, but I think we've also been very clear about keeping the economy going. Our record infrastructure spend and stimulus has been very good for jobs right across Queensland, so we're seeing that jobless rate to drop below 5%. We're keeping our election promises while we're managing the pandemic. We'll keep doing what we promised to do, and I'm sure the Premier and all of our ministers are focused on the job at hand.
Speaking of the Premier, would you support her running again?
Oh, the Premier has my 100% support. She has been amazing. She's been a bedrock of support and strength through, an incredible time with the pandemic. And she stood up to people that have tried to undermine our health response, especially from Canberra. She's shown the strength that's backed in the health of Queenslanders all the way.
Although it's lovely to see Dr. Linda Kinley, would it be lovely to see Dr. Young give her final daily COVID presser? Do we know if she's packing in preparation for tomorrow, or ready herself?
Oh, look, I can't speak for Dr. Young, but I'm sure she's preparing herself for her new role, and I think Queenslanders are incredibly supportive. Dr. Young has saved so many Queensland lives because she's so sharp, she's so thorough, and she says it how it is. And I think we're all grateful for her role in the last 2 years as Chief Health Officer, and I'm looking forward to her induction tomorrow as the Governor of Queensland. Good on her. It's fantastic to see. All good? Terrific. Thanks, everybody. Cheers. Thank you. Cheers. Lovely. Thanks, Steve.